Welcome to the Unpacking the Framework video series. This series provides valuable information about the National Best Practice Framework for Early Childhood Intervention. My name is Denise Luscombe, and this video introduction is being recorded on Whadjuk Noongar Boodja. I acknowledge the traditional custodians of this land and the land you're listening from, and recognise their continued connection to country, waterways and community. I would also like to pay my respects to their elders past and present. This video is one of a series that describes the evidence and practice information that underpins the principles of the National Best Practice Framework for Early Childhood Intervention. You will hear from both national and international speakers throughout this video series. This video covers community-focused, a key principle of the National Best Practice Framework for Early Childhood Intervention, and is presented by our international speaker, Dr Jose Boavida Fernandes. Jose is a neurodevelopmental paediatrician who worked at the Child Development Centre of the Paediatric Hospital, Centro, Hospitalar Universitário de Coimbra, for over 30 years. He currently works in private hospitals in the Coimbra region. Jose's areas of special interest include early childhood intervention, where he was involved in development of the first community-based early intervention project in Portugal in the Coimbra district. He was founder of the Portuguese Portage Association and the National Association of Early Intervention. He is a consultant of the Board of Early Aid, European Association of Early Intervention, and was founder of the European Association of Early Intervention, EAEI. He has represented the Ministry of Health in different working groups that led to the development of legislation that created the National System of Early Childhood Intervention in Portugal, or SNIPI. He is a representative of the Ministry of Health in the National Coordinating Committee of SNIPI, and acknowledged as an international expert on early childhood intervention. He has participated in training activities throughout Europe and Central Asia, as well as being an international early childhood intervention expert in the EU Twinning Project, support to Ukrainian administration in developing a legal and administrative setup to introduce a system of early intervention and rehabilitation for children with disability or having a risk of disability. Jose also founded the first ADHD clinic in Portugal, as well as being founder and chair of the Portuguese Society of Attention Deficit since 2016. Jose has taught courses on paediatrics across a number of universities in Portugal.
Thank you so much for the introduction. I'd also like to thank for the invitation to do this video on community-focused principle. This principle is clearly related to the need for everyone to work together and make sure that ECI services are part of an integrated system of support. Since I'm involved in the coordination of SNIPI, which is the Portuguese system of ECI, I'll refer it during my presentation. There was in the last 2 or 3 decades a clear paradigm shift in the provision of ECI services. They have evolved from a therapeutic, child-centered, clinical model to contextual support provided in natural environments like the home, childcare, or a preschool. Community-focused early intervention is largely the result of that paradigm shift and involves proactive strategies designed to identify and support eligible children and families facing developmental challenges before those challenges escalate. So there is a preventive aspect, extraordinarily important preventive aspect related with ECI. This approach emphasizes collaboration between various stakeholders, healthcare providers, educators, therapists and social workers, together with families, carers, collaborate as transdisciplinary teams, delivering services through a primary service provider. Together, they create a robust support system. So, community-focused ECI facilitates the implementation of the 5 recommendations of the European Agency for Special Needs Education and Inclusive Education. They are availability, proximity, affordability, interdisciplinary working, and diversity of services. Services should reach all children and families as early as possible. They should be available as close as possible to families, both at local and community levels. Should be offered free of charge, provided through public funds, and professionals should come from different services in the community and should be from different disciplines. And so the community-focused principle should be on the basis of any ECI system development. We know that ECI needs intersectoral work, and the success of intersectoral collaboration in ECI depends on the construction of an institutional structure. Building such a structure is an ongoing complex process, not a one-time exercise, and involves coordination, connection, partnership, communication, planning, and monitoring. This is the logo of the SNIP, which is the Portugal institutional structure for ECI. This is the logo of ECI. We have SNIP since 2009. It was when the legislation was approved in the parliament. It started really in the beginning of 2010, and it's a public responsibility system resulting from the work of the 3 ministries: health, education, and the Ministry of Social Policy. It's also always important to define stakeholders, sectors, agencies involved in ECI. There should be, in my opinion, a central core of public stakeholders, the Ministries of Health, Education, and Social Affairs, but other stakeholders, either at national or local basis, they are very important. Parents' organizations, other civil society institutions and NGOs, universities, and academic experts. And each of the stakeholders should designate a member to integrate an official planning committee that should plan and design the system. And once the system is implemented, should also coordinate all the actions of ECI. Of course, it's important for any program to adopt a clear conceptual framework and a national standard for ECI practice that should be evidence-based, and of course takes in consideration the role of experiences and the way children at early ages learn through repeated interactions with the environment in everyday life activities, not in therapeutic sessions, because their brain and central nervous system maturity is not prepared for that. Also important is the role of families and the need to be family-centered, and the role of professionals in transdisciplinary teamwork, working together with families and co-creating solutions that reflect social and cultural diversity. Collaboration, partnership, coordination are important concepts as far as community-focused ECI is concerned. ECI is an interagency and an interdisciplinary area of work developed jointly by stakeholders. Policy and guidance should emphasize the critical importance of coordination, key working, and joint planning. There should be a good definition of the role of each sector within the system, as well as the professionals involved at the different levels of functioning, the national, the regional, or the local level. And there should be, and it's very important, a good definition of financial responsibilities of each stakeholder. This is the map of Portugal. I'm sure you are not familiar with it, but we are a small country in the west of Europe. we are between Spain and the Atlantic Ocean, and there's a national coordinating committee which coordinates actions from the three ministries all over the country with 6 elements, 2 from each of the ministries. There are 5 regional subcommittees in the 5 regions of the country, and each regional subcommittee has 3 elements, 1 from each of the ministries. There are 22 technical supervision teams at the district level, and there are 156 local early intervention teams covering all the country. So it's important to define a structure, what professionals at each level. And so very based on our experience, there's a national and regional coordinating level, and there are the local ECI teams in the bottom, the basis of the system. That these teams are community focused and hosted in a regular context, which is, in our case, the health center, a place where all children go for regular health care. And in the middle, we have these technical supervision teams that provide support to local teams, and they also establish connection with the coordinating level. These are the constitution of our 156 local early intervention teams. Some are very small in very rural areas, some are very big in big cities, but typically they have primary care physicians and nurses. They come from the local health center. There are educators and special educators that come from the reference school for ECI. And there are social workers, psychologists, and therapists that come from a private institution, and they are hired by the local private institution and paid by the Ministry of Social Policy. And these teams are based in local health centers. They are inter-service and interdisciplinary teams. The role of the health sector is very important in ECI, and this is the role in SNP. I think it happens at 2 levels, primary health care and child development centers, which are the secondary and tertiary levels, which are children's hospitals or general hospitals with pediatric departments. And at primary health care in Portugal provides family-oriented health care. Typically, the physicians are general practitioners. They have a good training in pediatrics, and so they treat the mother, the father, the baby, the cousin, the grandpa. So it's a really family-oriented healthcare. They provide developmental screening. We have a national child health surveillance program that provides free universal access to healthcare quality guidelines at key ages, typically from birth to 3. The visits are at first week, 1st, 2nd, 4th, 6th, 9th, 12th, 15th, 18th, 24, and 36 months. So 13 visits from birth to 3, and they provide developmental screening with appropriate instruments, and that way they can detect delay, disabilities, and identify risk factors as well from a list they have in the system. It's primary health care that refers to local ECI team, but it's not forbidden for other sectors or even for parents to refer their own children. So, but typically it's primary health care. It provides professionals for the team, physicians and nurses, hosts the local team, and refers to the child development centers where there are a big team with developmental pediatricians, child neurologists, geneticists, and other medical specialties, and non-medical specialties like psychologists, special education therapists, and they can provide a specialized evaluation, follow-up, and intervention in most complex situations. Of course, unlike health, education, and social sectors have no preventive services or universal children follow-up that's happens only in the medical sector, in the health sector, but they have important resources for ECI. They have educators, special educators, psychologists, therapists, social workers, and facilities that are very important for ECI in the community. And so everybody can make a big contribution to the system, to ECI. The early years of life lay the foundation for future growth and greatly impact long-term health and development. This is especially crucial for children with developmental challenges or disabilities. For these children, it is essential to recognize and meet their unique needs along with those of their families as early as possible. Research shows that timely support can significantly enhance a child's cognitive and emotional development. Early intervention is crucial for child development. Connection and collaboration are vital in intersectoral work. When community services come together, communicate effectively, coordinate efforts, and share resources, they can create a supportive network that fosters growth and resilience in children and their families. Communities can implement best practices by fostering partnerships among services, involving families in decision-making, and creating awareness of available resources. Integrating a community-focused principle into early intervention systems can create a more responsive and effective framework. By prioritizing collaboration, accessibility, and cultural competence, we can better support families and promote positive outcomes for children at risk or with developmental problems. Thank you so much for your attention. Congratulations on this initiative. It was a big pleasure to participate in the presentation of this community-focused key principle within the Australian framework for best practice in early childhood intervention. The framework describes what is high-quality, evidence-informed support to children with developmental challenges and their families. Again, thank you so much. Bye-bye.
We hope you've enjoyed this video, part of the video series Unpacking the Framework for the National Best Practice Framework for Early Childhood Intervention. The review of best practice in early childhood intervention was commissioned by the Department of Social Services. Led by the University of Melbourne, the project team included PRECI, professionals and researchers in early childhood intervention, Murdoch Children's Research Institute, SNAKE, National Voice for Our Children, Children and Young People with Disability Australia, and ACD, Advocating for Children with Disability. Coordination and production of the video series was led by PRECI.